People worry about their thinking, and they worry that their brain is not working properly. What do you tell people?
Well, there are a lot of things that are associated with normal aging. There is such a thing as normal aging. And
Good, because I've got that.
And there's cognitive slowing. That's the universal truth. We all slow down with time. So it may be harder to find that word. You might forget and then remember what you forgot. And that's not abnormal. That's part of normal aging. So it's normal to forget names and then recall it even weeks later.
When do you know it's abnormal? Is there a time where you forget names and you can't remember anything? How do you know when your thinking is not just slowing down?
When it starts to impair your function. So sometimes you're able to forget something and compensate just fine, and it really doesn't affect your life. Lots of us are now outsourcing our memory to our phones, so we have the numbers typed in, so we don't remember anyone's number. That's normal. However, let's say you don't remember your phone and you don't remember how to use your phone. That's a little different.
And you don't remember where your phone is or how to work it?
Well, a lot of us misplace our phones, but maybe we're able to retrace our steps.
So if somebody finds out, who usually makes the decision that something's going wrong? A loved one that's watching that, or the person that says, you know, I'm just not thinking right. I can't remember people's names and I should be remembering them.
A lot of times it's a spouse or an adult child, a family member who says, your mom, dad, or my wife is just not thinking quite right. There's a change from normal. So the other thing that you have to have a diagnosis with is a change from your normal self. So a change from your baseline.
You know, and I see that all the time in people at church, where you see some friends and their spouses will say, I'm worried about my spouse.
Yes.
That they're not thinking well, they're not remembering as well, they perhaps are not making decisions as well. Is that something we should worry about?
Absolutely. I think it's always important to listen to family because many times they have the diagnosis. They're able to say, these are the symptoms.